Hello, welcome back. Today we'll be looking at the musculocutaneous nerve, and I'll be giving you mnemonics that can help you write essays about when you're asked to write an essay about the musculocutaneous nerve. The question that we'll be focusing on is describe the formation and the distribution of the musculocutaneous nerve. And I'll be giving an essay, a mnemonic that can help you form the outline. And this mnemonic is I only carry strong books regularly calmly. This mnemonic will not only help you form the outline for musculocutaneous nerve, it can also help you form the outline of all structures in the body that is in transit. I call this structures in transit because they have an origin and a termination. So when you have structures in transit, you can use this mnemonic, I only carry strong books regularly calmly, to form an outline that will guide your essay writing. I for introduction, O for origin, C for cause, S for structure, B for branches, R for relative, C for clinical correlation, and conclusion. Now, as a way of introduction, the musculocutaneous nerve is a branch of the brachial plexus, specifically from the lateral cord C5 to C7. It is a mixture. It is a mixture of motor and sensory nerve, and it has a motor and sensory function. The musculo for the motor function, and the cutaneous for the sensory function. Now, origin, it arises from the lateral cord of the brachial plexus, which is C5 to C7. Cause, the musculoskeletal nerve pierces the Coracobrachialis muscle, travels in between the biceps brachii and the brachialis muscles in the anterior compartment of the arm, and it continues as the lateral cutaneous nerve of the forearm after passing the elbow. So, okay, there is a mnemonic that can help you remember the cause of the musculoskeletal nerve. This mnemonic is PBB, which is pierce, between, and becomes. It pierces the Coracobrachialis, it runs between the biceps brachii and the brachialis, and it becomes the lateral cutaneous nerve of the forearm. With PBB, you can remember the cause of the musculoskeletal nerve: pierce, between, and becomes. Now, the structure, when you are asked to write on any structure, on any organ, on any track, on any space in the body, you are meant to draw and label what you are asked to write on. The drawing and label might not be so wonderful, but it's always good to draw because to fetch you marks in your exam. Now, for the structure, it composes of a motor fiber that supplies the flexor muscles of the anterior arm, and the sensory fibers that supplies the lateral forearm. Now, this is the diagram of the cause of the This is the diagram of the cause of the musculocutaneous nerve. This is the root, which is the lateral cord from C5 to C7. Then it pierces the coracobrachialis to form the musculocutaneous nerve. Then it passes between the brachialis and the biceps brachii. Then it continues as the lateral cutaneous nerve of the forearm. Now, for branches, one, it has a muscular branch. It has the muscular branches, which are the coracobrachialis, the biceps brachii, and the brachialis, and it also have a cutaneous branch, which is the lateral cutaneous nerve of the forearm. Now, a mnemonic here can help you know the functions of these supplies. This mnemonic is flex and feel. For it flexes the flexion of the elbow through the biceps and the brachialis, and feeling in the lateral forearm through the sensory function. Another mnemonic here can help you know the relation of the musculocutaneous nerve in the lower part of the axilla. This mnemonic helps you to know the relation of the musculocutaneous nerve in the lower part of the axilla, and this mnemonic is people say medicine cures. People say medicine cures. The P in people represent the pectoralis major, which which is anterior, which is anteriorly related to the musculocutaneous nerve. C, S in C represent the scapularis, which is posteriorly related. The medicine, the M in medicine represent the median nerve, which is medial relation, and the cures, C in cures, represent the Coracobrachialis, which form the lateral relation. Okay, for clinical correlation and conclusion, the clinical correlation you need to know about the musculoskeletal nerve that injury can occur due to shoulder dislocation, upper brachial plexus injury, and surgical trauma. So when there is injury due to shoulder dislocation, upper brachial plexus injury, or surgical trauma, it can lead to deficit like weak elbow flexion. Remember the mnemonic feel, flex, and feel. Weak elbow flexion, that's the loss of bicep brachii and brachialis function, and weak forearm supination, which is the loss of bicep brachial function. The sensory loss of the lateral arm, testing, they can also be the reduced biceps reflexes because of the loss of the musculocutaneous function, nerve function. Now, this mnemonic can help you remember the features of musculocutaneous injury, and this mnemonic is 3 Ws: weak elbow flexion, weak supination, and wasted biceps. Weak elbow flexion, weak supination, and wasted biceps. The next is conclusion. In conclusion, the musculoskeletal nerve supplies the anterior arm muscle for flexion and supination, runs between the bicep brachii and the brachialis, and ends as the lateral cutaneous nerve of the forearm, with injury causing weakness in this movement and sensory loss. So there's no, you don't need to cram or memorize things. You can write when you want to conclude an essay. The best thing you can do to know how to conclude an essay is just to know one function of what you're talking about. If you know one function of what they're talking about, you can use that as the conclusion of an essay. Now, if this mnemonic, I only carry strong books regularly, calmly, I have helped you or can help you write an essay on musculocutaneous nerve and other mnemonics in this video, please, I want you to like the video, share, subscribe, turn on the notification bell to know when I drop new content. I want you to keep watching, keep reading. God bless you. Thank you so much for watching.